Hi everyone, my name is Lihong Lin. Today I'm going to introduce my um, topic is the effect of dietary therapy on depression. For first, what is depression? Depression is a common illness worldwide, with more than 264 million people affected. Depression can lead to psychological self-hatred and irrational sympathies of positivity. In most several cases, it can have several psychological effects, leading to self-harm and even suicide. Close to 800,000 people die due to the suicide every year. Can depression be cured? Till this day, there is no specific treatment or completely prevention for depression. Have two ways to cure depression. One of the psychotherapy, and the second one is the antidepressant. It is the most useful today for cure the depression. Antidepressants are generally taken for life that due to their short-term effects, they can lead to the dependency and withdrawal reactions and many side effects, forcing patients to rely on this treatment for function normally. And for the dietary therapy, in this respect, dietary therapy can be an effective tool because it is healthier and contain no chemical. Although some of the most severe depression patients are unlikely on to respond to this basic treatment, it can act as perfect solution for the symptoms and the prevention of some mild depression. And for cause of depression, according to the study, one possible cause of depression is the brain disorder of emotion. Therefore, the main purpose on the treatment of depression is to improve the ability of the brain to regulate emotions. For nutrition, the right nutrients and the foods can also have an effect on depression. The example have the selenite is improved on the mood and reduce symptoms and of anxiety. And also the B12 vitamins helpful to maintain a healthy nervous system and brain. So my claim is the food therapy is an effective and acceptable treatment for depression because it is no side effect, lower dose restrictions, and help establish good eating habits. For first, no side effect. The first reason that dietary therapy is effective in treating depression is because it has no side effect. Except treating depression, antidepressant also cause a variety of side effects. So the nutritional therapy involves the intake of a variety of nutritious foods and nutrients, which are generally familiar the patient's life and do not make the patient's fear of the unknown. For the second one, lower dose restrictions. Based on the appropriate nutrition treatment plan, what if have this? No longer necessary for doctor to prescribe precise dosage and usage, nor for continual follow-up, and not necessary to specify a diet pattern that patients may not be familiar with adopt to, and the food can be ranked and included in the diet pattern selected by patients by using food rich in nutrients that are conducive to improving depression symptoms, and also make the patients feel controllable and bring the patients a sense of security. For the third one, the helpfulness uh, for establish good eating habits. The patients will form a kind of diet mood which emphasize all kind of nutrition. After forming a fixed diet mood, the abnormal performance of appetite and weight will be significantly improved. And additional is a good for brain health. Eating high quality food containing a lot of mineral and vitamin can nourish the brain and protect the brain from oxidative stress, which is produced when the human body using oxygen and damage cells. Eating food can help to reduce anxiety and improve mood, which make depression easier to control. And the question is, can food therapy replace antidepressant completely? Many people have the question for this. They think the food therapy have no potential risks, and the antidepressant associated with an increase in suicide through the behavior among young people and the teenager. So, and also the syndrome of antidepressant drug have will withdraw. But the food therapy cannot completely replace antidepressant because of different level of depression. Although food therapy can effectively inhibit and prevent mild depression to a certain extent, several several depression and persistent depression have had a substantial impact on the brain, which will greatly change the cognitive ability of patients. Patients must receive professional treatment from doctor and take antidepressant for a long time to be able to improve. And also, the food therapy has no strict standard and only play a auxiliary role. And the food and the drug administration monitors nutrition and the diet plan is a different way than the drugs. It is difficult to determine the effectiveness and the safety of certain type of food and supplements. Thank you.